How are reproductive cancer tumor markers like CA-125 used? Imagine a simple blood test that can give doctors clues about what's happening inside your body. That's what tumor markers like CA-125 do. They are proteins found in the blood that can be elevated when certain reproductive cancers are present. CA-125 is most often linked to ovarian cancer, but it can also be useful in other reproductive cancers like endometrial or uterine cancer. It's important to understand that these markers are not perfect on their own but are part of a bigger picture in cancer detection and management. In the early stages of ovarian cancer, CA-125 levels can be higher than normal. Doctors use this information to help decide if further tests are needed, like ultrasounds or biopsies. However, CA-125 can be elevated for reasons other than cancer. For example, conditions like menstruation, endometriosis, or pelvic infections can also raise CA-125 levels. Because of this, it's not recommended to use CA-125 as a screening tool for the general population. Instead, it's more helpful when used in women who already have symptoms or are at higher risk. When a woman shows symptoms such as persistent bloating, pelvic pain, or abnormal bleeding, a CA-125 test can support the suspicion of a reproductive cancer. If the levels are elevated, doctors may recommend additional imaging or procedures to get a clearer picture. In cases of endometrial or uterine cancer, CA-125 can help determine how advanced the disease might be, especially if levels are high. Higher levels often suggest more extensive disease or deeper invasion into the uterine wall, which can influence treatment decisions. For women already diagnosed with ovarian or other reproductive cancers, CA-125 is a valuable tool for monitoring treatment. During chemotherapy, a decreasing CA-125 level usually indicates that the treatment is working well. Conversely, if the levels start to rise again after treatment, it might signal that the cancer has come back or is progressing. But it's important to remember that not all ovarian cancers produce CA-125, and some patients may have normal levels even if the disease is present. Interpreting CA-125 results requires caution. A level above 35 units per milliliter is generally considered elevated, but this cutoff can vary based on age, menopausal status, and other factors. In premenopausal women, higher levels might be less specific because of benign conditions. Also, a small percentage of healthy women can have elevated CA-125 levels without any cancer. This is why doctors always consider other factors like symptoms and imaging results before making a diagnosis. Besides CA-125, other tumor markers can be used in reproductive cancers. For example, in testicular cancer, markers like alpha-fetoprotein and beta-human chorionic gonadotropin are more relevant. But for ovarian and uterine cancers, CA-125 remains the most common and useful marker. It's important to remember that tumor markers are just one piece of the puzzle. They help guide doctors but do not replace thorough medical evaluation and diagnosis. In summary, CA-125 and similar tumor markers are valuable tools in understanding and managing reproductive cancers. They help in early detection, assessing how advanced the disease is, monitoring how well treatment is working, and catching recurrences early. Still, their results must be interpreted carefully, considering the whole clinical picture. Always consult healthcare professionals for personalized advice and diagnosis, as each person's situation is unique. These markers are part of a broader approach to cancer care that combines blood tests, imaging, and clinical judgment to provide the best possible outcomes.